With the name of Almighty Allah, today we will discuss the hepatic hematoma, causes of hematoma, occurrence or location of hepatic hematoma, and also the clinical features and the sonographic findings of hepatic hematoma. So, what is hematoma? Collection or accumulation of blood is called hematoma, and when this blood collects in the liver, then it is termed as the hepatic hematoma. Now, what will the possible causes of a hematoma? Hematoma may have multiple causes, but the most common one we will discuss here. First, trauma. During trauma, the nearby vessels to the trauma place will give hemorrhage, which will lead to hematoma formation. Second, surgical procedure. After a surgical procedure, if the vessel at the surgical place didn't properly ligated or closed, they will give hemorrhage, which will again lead to hematoma formation. Third, hepatic or liver disease, especially those disease where liver is unable to produce clotting factor that prevent the blood from the hemorrhage. Now, location or occurrence of hepatic hematoma. On the basis of location, hepatic hematoma will have two types. First, intrahepatic, second, subcapsular hematoma. Intrahepatic hematoma is that type of hematoma where the blood collects or accumulates in the liver parenchyma, and the subcapsular hematoma is that type of hepatic hematoma where the blood collects below the hepatic capsule, which is a thin membrane that surrounding the liver. Now, the clinical features of a hepatic hematoma. During the hepatic hematoma, the patient will have discomfort and pain in the right hypochondrium where the liver is located. The sonographic findings of a hepatic hematoma. First, fresh hematoma will appear anechoic due to the fully penetration of ultrasound waves. Second, old hematoma may appear complex or anechoic. Complex will that area of hematoma where the blood will become clotted. Third, a hepatic hematoma may appear intrahepatic, I mean in the liver parenchyma, or subcapsular below the liver capsule or hepatic capsule during sonographic examination.